As we continue to monitor the deadly coronavirus outbreak, social media accounts are also spreading misinformation about the deadly virus.
As Axios reports, tech platforms including Facebook, Twitter, and Google are now racing to contain false information, much of which violates their content policies. So Axios media reporter Sarah Fisher took a closer look at this, and she's joining us now here in New York. All right, I guess we should not be surprised, Sarah, that this would be fodder for false information, right? We've seen it happen with vaccines. We've seen it happen with a number of other things. But these tech platforms are supposed to have all this stuff in place to limit false information. And they've been sort of screaming about it for a year now. You've been reporting about it for a year now. How is this stuff getting through?
I think one of the reasons it's getting through is because we actually don't know what is the correct information right now about the coronavirus. There's so much happening and so much that's unknown that how can the platforms in some cases say this is definitively wrong or it's definitively right when even health officials are confused about what's happening right now? Now, I'm going to push back on that and say, look, there are some things we know are obviously not true. Some of the things that are spreading on social media are that the U.S. government started the virus or that the Chinese government intentionally started the virus. There were tweets and Facebook posts going around saying that dozens of people in cities in the United States were infected. There's been no official word that that is the case. So we know that there are some untruths. I think at the end of the day, it's the same conversation that we have every time there's breaking news with misinformation, which is that these platforms just are not yet well equipped enough to handle it.
Yeah.
So how is the Chinese government dealing with the spread of misinformation? Because they do keep tight controls on social media in that country, but given the worldwide implications of this outbreak, they can't keep a lid on it.
They can. And they're having two kinds of problems. One is the problems of expats, people who don't live in China but are concerned about their families and friends in Wuhan and other regions in China. Those people are using social media, not just Chinese social media, but U.S. social media, which is much less regulated when it comes to their message. So that's one concern. The other concern is there is stuff that's spreading right now on Weibo and on WeChat in China because people are just so nervous, skeptical, and scared. One of the big rumors, we worked with Storyful, which is a social intelligence company, to figure out what are they talking about in China. One of the big rumors that's being spread right now is that the Chinese government did this intentionally, that they are responsible for it. There's already a lot of tension right now in China because there's so much global tension between China and the United States. That, of course, is a narrative that the government wants to clamp down on.
Usually when we're talking about misinformation, we're talking about politics. We're talking about the election. Are there similarities or differences when we talk about misinformation spreading about the coronavirus versus politics?
Anytime misinformation spreads by bad actors, they're trying to undermine trust and they're trying to take advantage of already scared or skeptical people. Healthcare is prime for misinformation because people don't know everything that they need to know about their own healthcare. And there's already so much skepticism around what's real. We see this with anti-vaxxers. We've even seen this with things like 5G will give you cancer. So that's one area. The other area and how it relates to politics is that there's not a lot of consensus right now about what's best for you. We see this all the time with moms trying to figure out illnesses and solutions for their kids. And so misinformation spreads when there's confusion and uncertainty. And of course, we have that in politics right now, but of course, healthcare too.
Sarah, I wonder, though, have there been studies done on why people, you mentioned that a lot of times we were covering this, we're talking to Sarah about this, and it has to do with politics. And we know that people generally want their political biases parroted back to them. So that's why they seek out sources of information that align with their worldview. But in the case of medicine, or in the case of science, like for me, when I started to hear about this, I went to the CDC. And that's what I trust. I don't trust my mom. I don't trust my neighbors. I don't trust even reporters who are just learning the information. I go to the source that tries to protect Americans. So the question becomes, why would people not simply call a doctor or go to the CDC or the World Health Organization? Why are they going to Twitter to find out what they need to know about this deadly virus?
My first reaction is there's not enough education. People might not even know to go to the CDC. So that's problem number one. Problem number two is that in this convoluted information era, people rely on family and friends. Well, what information are you getting from family and friends? What they post on social media. And so that's what people are taking as gospel as opposed to official sources. And then the last thing is that I think a lot of people don't have necessarily an affiliation to science, especially when it comes to these types of things. The fact that we have proven scientific evidence of things like climate change, but people choose not to believe about it, or we have proven scientific evidence that vaccines help stop the flu, but people choose to believe otherwise, that it causes other things despite no evidence, speaks to the fact that people might not necessarily want the best, most scientific information. They just want the information that reinforces their beliefs.
I mean, my grandma, rest her soul, like wanted to give me a little drop of whiskey when I had a little bit of colic. I don't know. You're a mom. Would you do that now?
No, and I wouldn't cop to it on camera. No, I wouldn't do that. But you know, this is what I was going to say. The other problem is clearly there's a mistrust when it comes to institutions. So they're not going to the CDC. They do trust their grandma, though. And I think that's part of the problem, even though grandma's not so good on Facebook. She keeps forwarding those articles from 1988.
FW,
Ford. You have to see this. That's Mom.
I think that institutional point that you made is crucial here. And especially this administration has done a lot, quite frankly, to consolidate power by undermining the trust of institutions, even ones that we always thought would be very well trusted. You've seen this administration turn its back on the intelligence community, on the military community, on its own agencies. Of course, it's hard for people to trust institutions because there's a systemic problem here of undermining that trust.
Yeah, so true. Sarah Fisher, always great talking to you.
Great to see you.